My name is Dr. Annemarie Selaya. I am board certified in pediatrics, and I work out of the Scripps Coastal Medical Center in Hillcrest. I chose to become a doctor just because I like to help people. I know that's a general answer, but it's actually true for most people, for most doctors. I chose pediatrics because I really enjoy working with children and watching them grow and develop. My areas of interest within pediatrics include special developmental cases such as autism, ADHD. I really enjoy working with parents to optimize their child's development. The most important part of the doctor-patient relationship for me is trust. I work with families, and it's very important that they trust what I have to say. And it's also very important that I listen to what they have to say, because the parent always knows their child best. So usually, based on what they're saying, we can come up with an answer that works for the family. The most satisfying part of my job is actually watching a whole family come together and grow, because we'll start off with one baby and then sometimes they often have more, and you get to watch all of the children grow up together. Scripps Coastal has been very supportive, so I love practicing with them because I have enough time with my patients. So they give us enough time with an office visit. I never feel that rushed or hurried, and that really means that I can provide better care. Every child should have a pediatrician because it's very important that we monitor and progress how a child is growing, not just physically in terms of their weight and their height, but also developmentally to make sure that they're on track. And I think it's important that families have a fresh perspective on their child, because they know the minutiae and the day in and day out. Sometimes it's very helpful to have an outsider come in and make a general assessment. It is very important for patients to get regular checkups, again, to make sure that they're growing and developing the way that they should, and that if there's any new problems, we can address it in the moment instead of waiting for it to become a long-term problem. The one thing that I think a patient can do to improve their health is actually preventative, which is what we do. I think mental health is important, and if a patient is prioritizing their exercise, prioritizing eating correctly, usually mental health will follow through with that. My hobbies and interests include horseback riding. I also enjoy walking my dogs and playing beach volleyball.